I became interested in epilepsy a long time ago. During my medical studies, I wanted to do research. I was interested in molecular biology and channels, and I didn't know exactly how to connect them. And finally it came out that epilepsy was a nice way to connect both, and my first research was on epilepsy channelopathies. It was, to be honest, not so much interesting from a genetical point of view, but it was the way I did get into epilepsy. And then I did go on with clinical epilepsy, and I'm a clinical epileptologist, but also in research on epilepsy, and I moved to electrophysiology. In France, things are not always really easy. So, of course, we have the same drugs, but it may take some time until there's a regulatory management of those drugs so that it can be reimbursed and available for patients. So I know that this is immediate in Germany, and then you negotiate. In France, you start to negotiate, and it can take years and years, and sometimes it's really difficult. Second, there are many devices, especially deep brain stimulation devices, that don't have any reimbursement yet in France, and we have to wait. So the thing is that mostly we have the same, but there might be delays before they are available in France. In fact, in epilepsy, we have several issues. The brain is not so easy to access also, and we are granted with the fact that EEG is a way. But EEG just records global activities from neurons and not specifically. So in order to better understand the epilepsy mechanisms, we have a lot of animal models. They are good, but the thing is that the human brain is not at all a rodent brain. The size is different. The organization of brain structures is different. The connectivity is different. The neurons are different. And so studying epilepsy just on animal models may be an issue. And in fact, we have a great opportunity, which is that some epileptic cases are treated by surgery. And we can use those post-operative tissues to understand better how human epilepsy is unique and how some mechanisms are at play, maybe both in animal and humans, and perhaps sometimes only in humans. So first, it's a great opportunity, and there are not so many neurological conditions that have access to those tissues. Then we had another gift, which is that when we remove human brain or parts of the brain, if you are nice with it, and if you have the good techniques, you can keep it alive out of the brain for a few hours. And it's not only alive, it reproduces its behavior just as in the brain, which means that in fact we have epileptic activities that are still recorded in the human postoperative tissues. But we can do much more than in vivo in those tissue slices. We can record neurons, how neurons talk to the others. We can block several pathways by drugs. And doing that, we discovered, for example, that interneurons that are supposed to pace the system may be specifically modified in epilepsy and may trigger epileptic activities rather than controlling them. By doing so, there may be also modification of chloride regulation, because chloride is the target of GABA, since GABA receptors are mostly permeable to chloride. And we have identified specific mechanisms in human tissue that will help us to better understand epilepsy and to develop new treatments. We have also used, for example, human tissue to validate some new targets, and we have even started a new company in Paris in which we manage those results with developing new drugs on new targets that were validated on human tissue. And finally, one of the questions would be, we know that drugs are developed on animal models. Depending on whether they work on animal models or not, they may be then studied in vivo in human patients, and perhaps tissues from patients might be a nice gap between both of them, and perhaps candidate drugs for patients should be tested in those human tissues. So it's a great opportunity, and it's still the beginning, and in fact we can even do now many other things in those human tissues because we managed to culture them and then keep them for several weeks, and this opens new avenues by long-term modification of those human tissue, new techniques such as optogenetic, for example. And so yes, human tissue is a great opportunity. It's not all at all in epilepsy research, and it still has to be developed.